Can a baby's first cry be heard around the globe? Can understanding one illness help prevent many others? Can we better celebrate life by acknowledging every death? Can we make every life count? Health Metrics Network. Better information, better decisions, better health.
There is something fundamentally wrong in a system where children are born and they live and die, and there is no knowledge of such existence.
People count the things they care about. So what does it mean about us when we fail to keep track of human lives?
We need to remember to ask questions about the bits of society that are the most hidden, the people who are at the bottom of the pile. Because unless we have information about what their lives are like, then we're not going to see the complete picture.
With large crowds and long lines, this hospital is not unlike thousands of others in resource-poor countries around the globe. Here, as elsewhere, health professionals struggle every day to combat disease and illness with resources that are woefully insufficient.
We are overwhelmed with the disease burden. You're talking about malaria, you're talking about HIV, you're talking about sexually transmitted diseases.
The countries with the worst health problems are often those with the worst health information systems. As a result, in the places where lives are cut shortest, we have the least information about why.
It's a shocking fact that every day 30,000 children die before they reach their 5th birthday. But to compound that tragedy by not being able to do anything about it, not being able to prevent it, because we don't understand what caused it, that's a crime.
You need to know where these problems are. You need to understand how do you allocate the limited resources to tackling these problems. So if you don't have the information to guide such decisions, you will be shooting in the dark.
Birth and death records, census data, reportable diseases. This information is routinely collected in wealthy countries, but rarely collected in low-income ones. And, if collected, the information often gathers dust instead of informing decisions. Health Metrics Network is committed to changing this. With technical expertise, tools and funding, HMN is working to create, strengthen and align health information systems around the globe. Because better information means better decisions, and that means better health for everyone. In the rural villages of Burkina Faso, distance and expense prevent many women from seeking care during pregnancy and delivery. So the limited information collected at clinics does not give decision-makers a complete and accurate understanding of maternal and newborn health. Consequently, here as elsewhere, hundreds of thousands of women and millions of babies die uncounted and uncared for.
50% of women are not giving birth in a safe situation with a skilled birth attendant.
However, at research centers in areas of Burkina Faso and neighboring Ghana, investigators are extending health information systems to rural homes and using information to address barriers to care. Here, surveyors collect data about pregnancies, births, deaths, and a family's overall health status. It's making a difference.
We've noticed an improvement since our investigations, especially in terms of maternal health and newborn deaths.
In rural Chiapas, Mexico, residents are spared the harmful outdoor air pollution of Mexico City. However, they receive a significant dose indoors from rudimentary heating and cooking techniques. And while workers in Bangkok may risk their lives commuting to work, the hill tribes outside of Chiang Mai face threats once they get there, through exposure to deadly pesticides.
People's lives are different, and so are their health situations.
Decision makers need strong health information systems that can identify differences in populations in order to effectively serve all.
Data is the only thing that can portray the fact the health problems of any country.
Information gives you the power to make the right decisions.
In the poorest neighborhoods of Bangkok, outreach workers go door to door, monitoring high-risk populations for avian flu and educating them about its risks. Surveillance efforts like these are essential for identifying emerging health threats and enable response teams to quickly communicate about and respond to these threats at the country, regional and global levels.
If you have a very efficient disease surveillance system in every country, immediately when there is a new case or a possibility of pandemic, the information will flow at the speed of light.
While emerging diseases like avian flu and SARS can spread rapidly, disease patterns often change slowly over time. In Mexico and Thailand, infectious diseases are decreasing, while chronic diseases like cancer, hypertension and diabetes are growing along with the nation's wallet and waistline. Traffic accidents are also increasing as more households obtain motorcycles and cars.
If you don't monitor those changes, you have the risk of getting very much behind of what's happening in the country in reality.
Increasingly, global development partners require measurable results for their investments. While this can improve accountability, it can also create inefficiencies.
Look at this problem from a country perspective. You have dozens of donors coming to you every day with pressures for information.
If we have to create an information system to respond to Global Fund, another information system to respond to Gavi, another information system to respond to Stop TB, another information system to respond to malaria, you can see how much we have to invest separately. We have limited resources everywhere. So we have to use our resources very well.
It's much, much more effective if we can reach a common view about what is required and then help the government to go and collect that information, then all of us come in with our tape measures and our slide rules and doing our own measuring, because it's not a very sensible way of doing things, and we can do it better.
What we need to do, and what Health Metrics Network is designed to do, is to consolidate those investments into a single set of simple health information systems that collectively serve the range of interests.
That's why HMN is a partnership of countries, UN and donor agencies, foundations, technical experts and others collaborating to create, strengthen and align health information systems.
We want to have the data to be able to make sensible judgments. The ability to give an assurance about the quality of data and improving data in a way that is internationally understood and respected is an enormous asset.
In Thailand, one of the very first countries to have really good data on HIV prevalence, especially in young men, they saw incidence rising. They immediately instituted a public health education campaign and were able to see very quickly a turnaround in HIV prevalence.
We need information for today to make decisions about where we invest today and where we go tomorrow. Informed decisions are better decisions. It's that simple.
We have to find out who is suffering what, where, when, and why.
Ultimately, health information isn't just about data and numbers, it's about people. Because when you're tackling poverty, inequity, and disease, the difference between good decisions and bad ones can mean the difference between life and death. Health information is about making every life count.
Everyone counts.
Everyone counts.
Chaque individu compte. Todos y todas cuentan.
Everyone counts. ทุกชีวิตมีคุณค่า
Todos cuentan.
Everyone counts.
Everyone